Hello, my name is Patpat Suwannasit, and in this video, I'm going to present an eclectic music therapy approach. This presentation is in partial fulfillment of requirements for the course Master of Creative Music Therapy at Western Sydney University, 2017. To begin, what is it and why eclectic music therapy approach? In contrast to many other music therapy approaches, eclectic music therapy approach is an approach that draws elements from many approaches altogether. The reason for this is that, in reality, clients are unique and different, and therefore it doesn't exist the universal model that can meet everyone's needs. In this particular presentation, I would like to propose an eclectic music therapy approach underpinned by humanistic psychology that combines a client-centered practice based on the main principles of community music therapy and the practices of Northrop-Robin creative music therapy. This approach can sound lengthy and indigestible at the beginning, but in the manner of not assuming previous knowledge from the audiences, I'm going to now be talking briefly about different components individually within this approach. First of all, I'd like to start with the humanistic psychology. The proponents of this psychology approach are psychologists named Carl Rogers and Abraham Maslow. Although each person possesses different theories, there are some common basic foundation. In general, humanistic psychology views the person holistically. It also holds an optimistic perspective that people are resourceful and have capacity to grow and develop in a positive way. In addition, people are primarily social beings and have desire to belong to a group and feel validated. In humanistic psychology, they assume that human behavior is a result from subjective assessment, or in other words, free choices, and also subjective experience, or their own experience. And the last, the meaning that's given by the person who does the action. Therefore, in humanistic psychology, we would understand that both cause and interpretation of behavior comes from the person who does the action, rather than the external factors. Now come the second ingredient of eclectic approach, client-centered practice. In regards to the therapeutic relationship, there are three core principles to follow as written by Carl Rogers in his book, The Clinical Treatment of Problem Child. The first principle is congruence, meaning that the therapist treats the client as equal to themselves. For example, in this approach, the person seeking help from the therapist is referred as client and not patient. This implies the equality in the therapeutic relationship. The second, the unconditional positive regard, meaning that the therapist is concerned about the client positivity and unconditionally, seeing the goods and avoid making assumptions and judgment. And the third one, empathic understanding, meaning that the therapist tries to understand the client from their point of views. As the old saying goes, put oneself in someone else's shoes. Having covered some features of client-centered practice, I'm now going to move on to community music therapy that is also included in my collaborative music therapy approach. So, what is it, community music therapy? It's hard to find an absolute definition. However, according to Gary Ansel, community music therapy is an approach to working musically with people in context, acknowledging the social and cultural factors of their health, illness, relationships, and music. It reflects the essentially communal reality of musicking and is a response both to overly individualized treatment models and to the isolation people often experience within society. Based on the given definition, this is an orientation that tries to convince that music therapy isn't confined to the therapist and the client, but also had an effect that goes beyond the therapeutic relationship. It also resonates through the surrounding people and may relate it to others. That is to say, music therapy has ecological quality. It has the ripple effect, as can be shown in this picture. As for the last component, I would like to also incorporate some practices and tenets from non-throbbing music therapy. Originally an approach designed for handicapped children, the central philosophy of non-throbbing music therapy approach is what come to be known as the music child. It is the belief that everyone, even people with disabilities, has musicality that resides within, waiting to be activated. Following this, through the use of musical improvisation technique, that is another vital part of this approach, the therapist and the client meet in the music by making music together. Non-throbbing music therapists view clients as an equal mutual musician and use a technique called musicking by listening carefully to the client and interpreting their behavior in terms of music in order to find the mutual musical meeting point. In addition, this mutual music making can provide an avenue in which growth and developmental potentials can be explored. As Clive says, we try to unfold the abilities that we can reach and develop them so that the child has more abilities for living. So, combining all the different components, what do we have as a final product? In my opinion, there are qualities of this particular eclectic approach. By putting all together the client-based orientation, such as humanistic views of the clients, assumption on the client's subjectivity, adopting client-centered practice, and the belief in innate musicality, I think that this approach has a great focus on the client. Therefore, the music therapy should primarily encourage self-actualization and act as a bridge where the client can bring the resource and experience from the session to their own environment and future daily life. In my opinion, I suggest that this eclectic music therapy approach can be used with certain populations such as adolescents who can speak, who may or may not have mental difficulties, no musical experience required, and who may have socio-economic challenges, because community music therapy is rooted in the belief that people have problems from the surrounding environment. The method can be one-to-one active music improvisation, instrumental with or without vocal, or group improvisation. It may also include verbal discussion after musical improvisation, in case the clients are verbal. It may include as well encouraging post-therapy musical engagement as demanded and requested from the clients. The goals of this approach can be to alleviate emotional challenges, or to encourage interactive communication, or to inspire and help the clients discover their hidden potentials. Based on my observation of professional music therapists working, I have discovered that music therapy session is conducted in a client-centered manner with the use of non-throbbing improvisation techniques. For example, most of the time clients can play instruments of their choices. I have also seen the registered music therapist create improvisation spontaneously from the close observation of the client's behavior. I have also learned to encourage and let go of the clients in relation to their condition on the day. Furthermore, in regard to my undertaking psychotherapy in the past, I have learned that the therapist often used the humanistic kind of question, such as, "What do you think about what you've done?" I think this has allowed myself to make sense of my own behavior, both good and bad. However, it would be interesting to learn more about applying humanistic dimension onto non-verbal modality therapy, such as music therapy as well. And that is the end of my presentation. Thank you for listening. I hope this presentation is useful for both current music therapists and future music therapists alike.